Good morning, everybody, and welcome to another episode of Intuitive Insights. My name is Dr. Yolanda Dukes, and today my guest is from South Africa, Dr. CP Van Eeden, and his healing modality is low laser therapy. Dr. Van Eeden, welcome. How are you today?
I'm doing great, thank you.
Tell me, I have never heard of this therapy. I need to know everything.
So I was lucky enough or blessed enough to be on a seminar in Malaysia several years ago, where we met up with a German doctor who developed this specific form of low-level laser therapy. Now, when we think of therapy or laser, we usually think of something that cuts you or that can burn.
Mm-hmm.
And what they found is that a low-powered laser has different effects on the blood, in the blood, and on the whole body. So they have, for many years, known that therapy is available on the skin. So if you have a skin cancer, then you can treat it with a blue laser and you can cure the cancer. But up to now, they've not been able to get the therapy into the body. And what this gentleman then did was he developed different ways of getting laser into the body and then have the therapeutic effect of that.
So the therapy treats blood disorders or different?
Many different things. There are currently over 85 applications for it.
Oh.
So it is a part of what we practice here of integrative medicine, and we call this regenerative medicine. Okay. So what you do is you allow the body to heal itself. So you give it the tools and the building blocks to better heal itself. And so one of the big things that the different colored lasers do is it energizes the mitochondria. Now we know that the mitochondria is the powerhouse of your cell, and that is where your energy is created. Now, just a side note on the mitochondria, which I found fascinating, is that your mitochondrial DNA is not human.
What?
So at some stage we fused with something, and it's a synergistic experience. So every cell of us has a little alien inside of it, which is the mitochondria.
The only thing that I know about mitochondrial DNA is that if you look at it, it's like the mother's DNA. So what you're saying is the original mother was not human.
So at some stage, the human cell and the mitochondrial cell fused.
Wow.
So one cannot exist without the other.
Mm-hmm.
And so what we do is with the different lasers, we recharge the mitochondria to create more energy. So if that is true, then we can treat many different disease states and challenges. So one of my passion treatments, of course, is cancer therapies. Mm-hmm. I went through the journey of cancer myself. So it is a massive therapy or passion for me, is to help people through that process. And what you do with the cancer therapy is you actually inject what we call a photosensitizer into the blood and into the tumor itself. And what happens there is that the photosensitizer sticks to the cancer cells. And when you shine the laser on it, in simple terms, it basically just kills the cells that have been stained.
Wow.
So you don't have, it's really phenomenal. You don't have all the side effects that conventional treatments necessarily have. It's not a side effect-free treatment, but it is a lot more gentle on the body.
So you yourself was diagnosed with cancer at some point? Okay.
Yes. So,
okay. And what type of cancer did you have?
Breast cancer.
Okay. Okay. Because a lot of people don't realize that men get that as well.
Yes. And again, that's what brought me to this path. I was working as a legal business analyst at that time, about 8-9 years ago. And I was just led to the path of sharing with people that men get breast cancer in the first place and that it is treatable. And cancer is treatable. It's not a death sentence necessarily. Now, we don't know what people's life paths are and why they get these disease states. to me, it's all about lessons that we need to learn. For me personally, cancer was the biggest gift that I ever got, because
Wow.
it
Oh my
put me
goodness.
into the path of medicine.
Yeah.
So, yeah.
So yeah, you turned your journey, instead of looking through it through eyes of pain and suffering, you turned it into a journey of healing and helping.
Most
Oh,
definitely.
I love
So
to hear that. So
it was
how
really
many
interesting.
treatments did you have?
So this was, like I said, 8-9 years ago, and we caught it really early. So I only needed to have it cut out, and then we looked at my hormones. And integrative medicine says, let's look at the cause of disease.
Mm-hmm.
Let's not just stick a plaster over it and hope it goes away. So my hormones were out of whack,
Mm-hmm.
and we don't realize that things like even our drinking water is laden with hormones,
Mm-hmm.
estrogen especially. So ladies go onto the pill, they pee out hormone estrogen water, and it's not taken out of our drinking water.
Ah.
So all of those things come into play. Pesticides are hormonal mostly. So we sit with bodies that are already estrogen dominant, and then we get things like our vitamin D levels. We don't get enough sunshine.
Yeah.
Now, South Africa is one of the sunniest countries in the world.
Mm-hmm.
And even here, upwards of 80% of South Africans are deficient in vitamin D.
Mm-hmm. Is it
And
all
that
the
fights
office
against
work, the
cancer.
being indoors?
That, as well as the fact that when you do go outside, you put on sunscreen.
Mm-hmm.
So you stop the burn, but you also stop the good stuff from getting through.
Okay.
So my journey was basically that we could then mitigate the risk. So I take my vitamin D in a capsule now,
Mm-hmm.
and I check my hormones every couple of months.
Wow. So you went on to get training. How long did it take you to get training, and what would a person need to be trained as a low-level laser therapist? Would that be
Okay.
right?
Yeah. So there is, you get different courses that you can do. I did basically an online course.
Okay.
The big thing to learn, of course, is about the safety of lasers.
Yeah.
Even though it's a low level, you can still blind somebody if you don't use it right, or you can burn somebody's skin if you are not aware of the different effects and the variables that come into play. Because I work in the industry at the moment, we were able to go to Bangkok to a summit where they showed us how to use the lasers, and I had most of my training was in-house, and then also a lot of it in Germany itself.
Wow. So you said that different colors have different effects. Tell me
Yes,
about that.
it's so pretty. Sorry, so like your chakras, your red laser, for example, is complex 4 of the mitochondria that helps with, but it's also anti-inflammatory, and it promotes microcirculation.
Wow.
So that's always my go-to. That's my start color. And the things that I mentioned are just the basics of what the lasers do. The green is detox, and it also helps you to get more oxygen. So your oxygen potential in your blood within 10 minutes, if you do it intravenously, is 20% higher. So we know that oxygen promotes healing.
Yeah.
And if you add on top of that the microcirculation of the red that's now better, you get more blood flow plus more oxygen delivery. So that in itself is a beautiful therapy. Then we use a blue laser that helps with nitric oxide release, also with lactic acid. And the big thing there is the blue is very strong anti-inflammatory, and it makes you physically live longer.
Wow. That's the blue?
Yeah, it is the blue. So that's what we call anti-aging. For us, anti-aging is not necessarily Botox and fillers and looking pretty. It is the inside. So what the blue does is it allows cell replication to happen more often, or more times. So it lengthens the lifetime of a cell.
Wow.
Doesn't
So
say
it
if you
actually
go,
has
if
an
you,
effect on the telomeres of the cells, what you're telling me.
yep,
Wow.
telomerase.
So
Yeah.
I must have read that 5 years ago just to prepare me for this conversation with you. That's how fascinating that is. Wow.
The telomere is quite a fascinating thing. So yeah, it lengthens the telomere.
Wow.
So
I'm blown away. I'm
it
absolutely
is
blown away.
really, really phenomenal. And then we get the yellow. Now the yellow we also call gold. If you see the light, I think the one photo I sent you was of the yellow. It looks like a golden color.
Yes.
And that's intravenous sunlight to me. I also call it intravenous prayer because it works on your melatonin, so you sleep better. It works on your serotonin, so you feel better. And it works on vitamin D as well as chronic pain.
So it's sunlight.
It's sunlight. Yeah.
So how long is a treatment?
We, again, integrative medicine doesn't have a set recipe.
Okay.
So we choose the colors according to what the person needs. But now, if you have those 4 colors, we have an ultraviolet as well, which is antifungal and antibacterial. So out of those 5 colors, I usually tell people do all 4, because how do you not want microcirculation or the telomerase or whichever effect? So we do 10 minutes per color usually.
Okay.
Intravenously. So it's 40 to 50 minutes. And I like to do about 6 sessions once a week. And then we reassess and see, has it worked, has it not?
6 days straight?
No. Once a week for 6 weeks.
Oh, okay. Wow.
Yeah.
So what's the most amazing result that you have seen from this?
Yeah, there's so many. The one was one of my first patients. So this machine took me 3 years to save up for and just do research for and get. And this lady she sat on flesh-eating bacteria in China on a trip there. And the wound had been open for 2 years, roughly, which they'd not been able to get it closed through surgery or whatever, the bacteria was still there. And it took us 7 weeks, once a week, and the wound is closed.
Wow.
So you get so many stories like that with the cancer people. We're working with new therapies there now where people are really getting better. One of my big projects at the moment is we are helping somebody with motor neuron disease. And I have good hopes for his therapy that it might actually stop the progress and hopefully help with the reversal of it.
This is unbelievable. I have never heard of this is why I do what I do, to learn new things. You are amazing. You are
really lovely stuff.
Forerunner in this, and it's amazing.
Wow. It's amazing to work with the people that we work with as well. So the laser is one modality that we practice here. So we combine that with other things. I don't believe in a single approach to disease management. So the laser is that's the bells and whistles now, and the very geeky stuff, because the geek stuff makes me happy. It's really like living in Star Wars when you walk into the room. A Star Trek, rather. Actually, it's more Star Trek.
Yes. But that's what I'm figuring out. The more I do these interviews and I reach out to people, this life really is like Star Trek, because now they have this plasma technology, and we're talking about healing with lasers and with light. It's just fascinating.
Yes.
Wow.
Yes. So the laser to me is a catalyst therapy. We then combine that with the training that I've done. I'm not allowed to do things like hormone therapies or drips, IV therapies, but I work alongside medical doctors, where we then combine the laser with things like intravenous therapies, where we make up a drip per patient requirement. Yeah. So I call it the kitchen. So we mix up the batch for whatever you need. It's, again, not something that you go into a pharmacy and say, this is my script, this is the medicine. They take it off the rack and they give you something that's a one-size-fits-all approach. We actually work with pharmacies that makes medicine per patient.
Wow.
So that it's going back into the old way of compounding medicine and having the herbalist mix the medicine for the person that they're trying to help.
Yeah.
So yeah, we do the IV therapies, we do ozone therapies, oxygenated or ozonated saline and things like that. So all about just helping the body to heal itself. Now,
so it's hard for me to understand. Like, I know you sent me the picture with the laser, and I see the light in going into your arm.
Yes.
It's hard for me to wrap my brain around how it flows into the arm.
Okay. That's actually very simple. So what we do is you would put up a normal cannula into the arm. So I've got a little, I think you can see that. It's a normal needle for a drip.
Okay.
That you would put up into the vein. And then the Germans, and that's what one of the most amazing discoveries or things was that they made, is they developed a piece of fiber optic cable that then goes into the needle and into the vein. And it's so simple. Yes, and so silly, not silly, but why didn't somebody think of it so much easier?
Yeah, because they use fiber optics all over the place, and we know that the information travels through the fiber optics to its destination. So it could do the same thing in the cell.
Yes. So what happens then is the light or the laser shines at one spot in the vein, and we irradiate all the blood that flows past. And that's how we get to the whole body.
Wow.
So you don't have to have, it's not that the whole body lights up or anything funny like that. It's just the one spot. And so that's the one method of application is the intravenous. Then you can also put it, if you have a knee injury, you can put the needle behind the kneecap and then shine from the inside out. I treat people with neurodegenerative disease like Alzheimer's with a specific laser that you would put on the skull. And on a very specific point, the yellow light shines through into the brain. And I use that for stroke rehabilitation, as I said, Alzheimer's, Parkinson's. The device also allows you to do auricular acupuncture or normal acupuncture with laser instead of using needles.
So are they doing this in the U.S.?
The Mayo Clinic uses it, yes. Yeah.
Wow.
And it is FDA approved. So it's not seen necessarily as alternative treatment. It's just very new.
Yeah.
Although in Germany, they have been using it for close to 10 years already.
Oh my goodness. People are just going to be thrilled. I have something called ankylosing spondylolisthesis, which means that my spine is fused. And I wonder if that could help me. Yes.
So what we would do for you is maybe interstitial. So immediately I'm thinking stem cells that is harvested from your own body. So it's not an invasive thing at all. And it's also not harvested from your bone marrow necessarily. So they do a fat harvest. And out of the fat, they then get the stem cells and they inject that
back into your body as healthy cells.
Yes. So they would do that close to the spine, and then also do some platelet-rich plasma. So that's also from your blood, extract some platelets, inject that with the stem cells, and then activate all of that with laser. So the laser supercharges the stem cells and the work it does.
Wow.
So that would be the one side. The other side, of course, would just be a topical, what we call a laser wash, where you would do from external. So your red and infrared lasers penetrate between 8 and 12 centimeters into the body. So you would then do a slow wash over that area to help with the inflammation and the pain and
I know that we are
Uh,
doing that here. That's
mhm.
been in the U.S. for a quick minute. I think about the last
Yes,
15 or 20 years, they start
yeah,
introducing those type of therapies in doctors' offices. That
yes, yes.
is
So,
amazing.
it's, yeah, so it's not a new therapy, it's just a new application of an existing therapy.
Okay.
Yeah.
Wow. So where would a healer go if they wanted to get some training or learn more about this? Where would they go?
So the I love the work that the Germans do. They're not the only company who does all of this type of work.
Mhm.
Um, they are the pioneers, though, in my mind.
Mhm.
So the company is called Weber Medical.
Weather medical.
Um, Weber,
Weber.
Weber. Yeah, yeah. So it's Dr. Michael Weber and his family. It's a family business, basically.
Okay.
Um, and it's run in a very small town in Germany. So you have to take a train there, 2.5 hour train trip, and they don't even have a pharmacy in the town. So if you need medicine, you have to get into the train or onto the train and go to the next town to get your medicine.
Okay.
But people flock there from all over the world for their therapy. Now, to me, because it's in the mountains and it's really a beautiful, beautiful clinic that they have there, um, that's part of the healing process.
Yes.
And I don't believe in a clinical setting anymore. So all of the things that we do here also has the mindset and the spirit needs to come through as well.
Yeah.
Um, and they actually built that into the laser. So, excuse me, on top of what you can already do just with the light, and it's not a singular light, it's billions and billions of photons that
Yes.
you inject into the vein or
Hmm.
wherever, but you build, excuse me, a frequency on top of that as well.
Hmm.
So you can say, I want a yellow light on the frequency that is called self-heal, which
Hmm.
is 4,625 hertz.
Ah, okay.
So they bring in more a Chinese medicine perspective as well. And that is, to me, very powerful and beautiful.
Wow. Oh my goodness. I am so enlivened and enlightened by your knowledge. Thank you so much.
It's only a pleasure. It's really an honor to be working in an area like this where you can live out your passion and be the geek and still help people.
Yeah.
Um, and that's in the end what we want to do is just make people's lives easier.
Yeah.
So even in the practice, we don't necessarily just, as I said, tell a patient, here's your medicine and go.
Yeah.
So when they come for their first session, there's a lot of counseling that happens.
Mm.
Mindset, diet. You get so many times here where um, a person would go for their cancer treatments, their chemo, and then walk out with a pie and a Coke.
Yeah. They're not
And
contributing to their own healing at that point.
yes,
Yeah.
yes,
So it's
I
holistic. It takes everything into consideration, your
yes,
attitude, your willingness, your
mhm,
intention, your spirit, your physical body, and takes
yeah,
all of that to get you right again.
definitely. I always tell people that everything that we do in the practice is to give your body the ammunition that it needs
Mhm.
to fight this battle that you're fighting.
Yeah.
We cannot tell the soldiers to pick up the guns and fight.
Mhm.
That's up to them.
Yeah.
So, and it is, they need to get the mindset right.
Mhm.
So, in that, we spoke about that as well at some stage, that because I work with the spirit as well, not necessarily religion, but just get the spirit behind it all. Um, I ask people, do you pray for your food or do you bless your food? And most people would say yes, or there's an element of mindfulness. And my next question is usually, do you pray and bless for your medicine?
Ah.
And invariably, that answer is no.
Yeah. I've never done that. Didn't cross my
And
mind.
and for me, it just doesn't make sense that we don't do that.
Yeah.
If we look at Dr. Miyamoto's work on the structure of water,
Yes, yes, fascinating work. Yeah, and
it
it
is
makes sense because
fascinating.
we're mostly water.
Indeed. Now, we do a lot of intravenous treatments, which is also mostly water with a little bit of medicine injected into it.
Yeah,
So if you go to your therapy session, you say, I hate this medicine because it makes me feel bad. That's the energy you're putting into that water of hate.
yes, yes.
How's it going to help you heal?
It won't.
So, exactly. Or it's going to give you a very, very tough time while doing it.
Yeah.
So that's why I write Reiki symbols on the boxes that we keep our medicine in. So that,
Really?
yeah, yeah, we mix spirit and medicine a lot here.
Ah,
Um, so because the one cannot be without the other, I believe.
yes, because
So
you can't have a physical body without it being animated by spirit. So it only makes sense.
yes, yeah. So with the people here, if a nurse opens the cabinet and she doesn't necessarily practice Reiki, but she sees that symbol and she activates it, or she just thinks, oh, somebody wrote something for healing on here, so her mindset is healing.
Yeah,
And
that
again,
is
we
fascinating.
it's lovely, and it has an effect on people. Um, it's not just a place where you come for medicine. We really try and walk a path and go through a whole journey with every person.
You come for healing. Well,
Mm-hmm.
Dr. Van Eden, thank you so much for your time. This has been a lovely and enlightening conversation. I thank you so much.
It was a greatest of pleasures.
Do you have any last words for the people out there listening?
Be mindful. Be aware of what you put into your body. When we eat, it is not just something that we put in to feel full. We are feeding a lot of things in the body. So know what you put into your body and know the effect that everything that you put in your mouth has on the whole body.
Okay. Okay. Oh my gosh. Thank you guys for tuning in. I so appreciate you. I truly hope that you find the value in Dr. Van Eden's words. I am truly moved. My spirit is moved at this moment. Thank you guys.